Hello, Neil O'Neill for Pursuit Physical Therapy, and there's been a lot of discussion about COVID-19 and how it attacks your system, but today I wanted to kind of give maybe a more layman's description of how that happens. What's the difference between acute respiratory distress syndrome and COVID-19, the way it attacks your system, which is much more similar to high altitude pulmonary edema, which is called HAPE in the industry. So HAPE and COVID-19 affect a different part of your system than acute respiratory distress syndrome, or ARDS. So we've been treating, well, not we, the doctors have been treating ARDS with ventilators, and they're finding out, well, gee, we could share ventilators, and actually maybe just putting oxygen in a mask to their face helps just as much as does a full ventilator. And one of the reasons for that is, or maybe the main reason for that is that high altitude pulmonary edema and apparently COVID-19 both attack the pulmonary artery and not the pulmonary tissue. So let's again, as I said, let's put this in layman's terms. So say I'm the alveoli, which are the little sacs in the lungs, and here's the lumen that air comes in. And in an ARDS, or acute respiratory distress syndrome, what happens is mucus builds up, and the body gets tired of pushing air up to my wall. So if air gets pushed up to my wall, my job as an alveoli is to grab onto oxygen out of the air and put it into the capillary or artery, more likely a capillary in this case from the pulmonary artery. And so I sit there, I do my job. Well, something happens where I'm not getting air up against me. There's mucus in the way, or there's just dead air without oxygen in it up against me because the air is not getting pushed out and in and out and in. So this gets to be used up air. Well, that means that for whatever this is here that doesn't let me grab onto oxygen molecules and put them into the capillary, that has to be changed. So in ARDS, acute respiratory distress syndrome, doctors put you on a ventilator, and that ventilator forces air in close to this alveoli sac, who can then grab onto oxygen and then put it in, and of course pulls out carbon dioxide and says, pull out carbon dioxide, pull in oxygen, put it in there. So that's how that would work. But in this case, what's going on in high altitude pulmonary edema and COVID-19, that's not the case, that there's a barrier here, that this alveoli can't get a hold of oxygen. It goes to put oxygen in the capillary and it can't do it. Now it's still pulling the carbon dioxide out. And you can see there's a problem here because the person's not getting the message that they don't have air because the carbon dioxide levels are not growing. There's levels of carbon dioxide that drive the ventilatory effect. So they're not breathing heavy, they're not gasping for air, they're not doing all these things, which is why you've seen some of these YouTube videos by MDs who are on the front lines seeing this going, hey, this doesn't make sense. This can't be ARDS. It has to be high altitude pulmonary edema or a similar process here with COVID-19. And that's really what it is that it's not that the alveoli can't grab onto oxygen, it's that it can't put it in the capillary, right? It's going up against a brick wall going, hey, what's going on here? It can pull the carbon dioxide out, that will diffuse across the artery, but the oxygen will not diffuse into the bloodstream from the alveoli. That's the problem. So just in a kind of summary in layman's terms. So there you have it. For your understanding, we'll do some more videos on what we as manual therapists do about that problem, about changing that basement membrane biochemical and bioelectric status so that oxygen will diffuse across there.